Hello everyone and welcome back to the channel Radiology Rock. And today we will be diving into one of the most fundamental topic in neuroimaging, that is the MRI brain planning. Whether you are a radiology student, a technologist in training, or a fellow educator looking to brush up on the basics, this video will walk you through step by step how to plan a high quality MRI of the brain. You can learn patient positioning, slice orientation, and clinical protocols. Now, before we get into the technical part, let's talk about why brain planning is so important. Poorly planned brain MRIs can lead to misdiagnosis, missed lesions, or the need for repeat scans. This not only wastes time and resources but can delay treatment for the patient. Good planning ensures we get diagnostic quality images that clearly show the area of interest, whether we are looking for tumor, stroke, demyelination, or something else. So now let's start with the basics. First, explain the procedure to the patient to reduce anxiety and motion. Make sure the patient should be comfortable. A patient lying on the MRI table with their head positioned properly. First, we position the patient correctly for the brain scans. The head is placed in the comfortable and neutral position with minimal movement. Remember one thing, proper head alignment is crucial for accurate imaging. Make sure the chin is not tucked in too much. This can distort axial images. Use padding to minimize motion and always double check the laser alignments. Always confirm there are no contraindications like pacemaker or metal implants before entering the scanner. So now come on the screen. Once the localizer is acquired, we begin our planning. Start with axial sequences. They are typically aligned parallel to the anterior commissures to posterior commissures, which is called ACPC line. This ensures reproducibility and standard anatomical views. Then move to the coronal and sagittal planes. Depending on the indication, coronal images are often planned perpendicular to the ACPC line. Always ensure you are covering the entire brain from the vertex to the foramen magnum. Now I am going to show you some most commonly used sequences, that is the T1 weighted images, which is good for anatomy and post contrast imaging. Then T2 and FLAIR, best for pathology like edema or demyelination. Then diffusion or DWI, essential for stroke. Then SWI or GRE for hemorrhage or microbleeds. Then post contrast T1 when looking for tumor infection or metastasis. I also let you know how protocols vary based on clinical indication. Like stroke protocol, start with diffusion, ADC, FLAIR, T2, and SWAN. Tumor protocol include T1, pre and post contrast, FLAIR, and high resolution T2. Epilepsy, thin slice coronal T2 and FLAIR through the hippocampus. MS or multiple sclerosis, axial and sagittal FLAIR, especially through periventricular areas and corpus callosum. So each institution may have its own specific protocol, but the goal is the same. But some common mistakes I often see, that is planning axial slices angled incorrectly, not parallel to AC or PC line. Missing the cerebellum or upper cortex in slice coverage. Not checking for motion artifacts before moving on to the next sequence. Using incorrect FOV or slice thickness for certain protocols. So as a technologist or student, always double check your planning before hitting start. And Always communicate clearly with your patient. Align your slices properly. ACPC is your best friend. Tailor the protocol to the clinical question. Review your images on the spot for motion, coverage, and quality. If you master the basic of brain planning, you will contribute to the faster diagnosis, better patient care, and more confident reporting by a radiologist. So thank you so much for watching my video. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you don't miss future tutorials on MRI, spine, knee, and more. Bye bye. See you in the next video and happy scanning.